Hello there, ladies. This is our last video that you're going to be watching for this course. So I can hear the cheering going on right now. But in this learning unit number 14, please make note of the dates. This learning unit is our last full learning unit, but it's in a shortened period of time. So this learning unit will go from May 1st through 5th, which is a Friday. So please note that things are due on Friday. And the reason for that is so that you can prepare for your final exams. And there won't be a final exam, but there will be a final course reflection that is listed actually as learning unit number 15, just to kind of keep that information in one area. And that you have, it is the dates for that are May 6th through the 11th. And the 11th is actually the very last day of finals. So that's the last day I can accept the final course reflection or any assignment. So you missed an assignment for learning unit number 14. The 11th is the last day I can accept anything. And that's just so we can get our grades in because some people are completing programs, etc. So just please note the dates. What was I going to say about that? I don't know. But moving along. So this is the learning unit where we're really focused on applying evidence to our practice. So you know already that you have learned how to read, understand, interpret, and apply research findings from nursing and other disciplines into clinical practice. That's what this course has been about, evidence-based practice. So as we conclude, we know that we are nurse researchers prepared at the baccalaureate level to integrate the basic elements of evidence-based practice, including the level of evidence of each article, as well as patient preference and clinical expertise. Let's stop there for just a minute and let me move to the hierarchy of research evidence. So in your, I wish it was a little better, but oops, that's not going to do it. So in your text on page 81, table 4.7, it gives this information, but it gives, which is the level of evidence, the hierarchy of evidence and research, but it gives it in a narrative format. So this is kind of nice because it puts it together and it's talking about the quality of evidence. And we start this pyramid at the bottom. And the lowest level of evidence is just background information. It does include expert opinion. So clinical expertise is part of evidence-based practice and non-evidence-based medical guidelines. So just know that that's the lowest level. But typically we start with some type of research, and we have observational studies, case reports, case series or studies, and cohort studies. Then higher levels of evidence are non-randomized controlled trials, and of course, higher up, the gold standard is an independent individual studies, is randomized controlled trials. And then we look at even evidence-based practice guidelines, which takes these mostly randomized controlled trials, but some non-randomized controlled trials as well. And we develop guidelines, or not we, but guidelines are developed based on this research. And systematic reviews, and the top of the pyramid for the hierarchy of evidence is a meta-analysis. And a meta-analysis, which I'm having difficulty saying, is clarified for you on page 73 of your text. So if you're sitting there going, well, I know a systematic review is looking at a number of studies, but meta-analysis, look to page 73 at the very bottom, and it will better explain what a meta-analysis is. So That said, let's go back to what we are looking at here. And I think I wanted to add one more. No, let's keep going here. So we've done evidence as far as the hierarchy, and when we say patient preference and clinical expertise, that's what I wanted to add in here, is on page 65. There is a quote by your authors, the very bottom of the page, and it says, evidence-based practice begins by asking, what's the best possible evidence available to solve whatever clinical problem we're looking at? So yeah, you don't want to go to a case study if there's randomized controlled trials, right? So what's the best possible evidence? And then it goes on to say the important sentence that I want to draw your attention to. Although findings from rigorous research studies are considered the best possible evidence, evidence-based practice draws on other sources of systematically generated evidence, and that includes clinical expertise and patient preferences. So please make sure that you realize evidence-based practice does not leave the patient out, and it does not leave the clinician out. It is the highest level of evidence along with our patient's preferences and our clinical expertise. So it seems like we've missed that along the road, and I wanted to make sure that this was highlighted. And so we've talked about being on research teams and identifying potential research problems, and most recently sharing our findings, disseminating our findings through our research posters. So the end of this week, you're going to be able to do what we just did, to reflect on the level of evidence and evaluate the experience of evidence-based practice as it relates to what are we doing evidence-based practice for? Improving patient outcomes and setting benchmarks for care. So I want you to review that paragraph that I just read to you on page 65. It's one paragraph. And table 4.7, which is on page 81, is the hierarchy of research evidence. Then the main component for this course is two parts. It is completing the IHI course on responding to adverse events, that's PS 105, and participating in the discussion. There's not going to be a quiz. Instead of your 10 points for the quiz, they'll be added on to the discussion board. So this hierarchy of evidence is there for you. The link to the IHI modules, and here's where you're going to upload your certificate, is here. There is an article on dealing with adverse events. So after you do PS 105, then take a look at this study. I do not expect you to read the whole study. What I'm most interested in is one page, E51. It's the first page. Read through. It has their methodology, etc. But read through the literature review. And please note that this is a meta-analysis. So again, questions on that, page 73. So you're going to be looking at information on adverse events, both a study, a meta-analysis, and the IHI course. You're going to be reviewing your classmates' presentation. You haven't finished them yet, so I'm waiting eagerly, anticipating them, looking forward to putting them up. So for the discussion board, the final point is, how are you going to apply the information that you learned in the IHI PS 105 and the evidence found in at least the literature review of the article above, dealing with adverse events, a meta-analysis on the second victim's coping in practice. So how are you going to apply this information and evidence in your practice. And then I want you to review your classmates' poster presentation and share what you think regarding the poster's strengths, the poster presentation's weaknesses, and opportunities for change. No reply is required. And so again, find at least, it won't be hard to find the strengths, but find at least one weakness or relative weakness, an area and in an area that could be changed, reworded, additional information, something like that. But I want you to critically appraise it and offer that feedback to your classmate, of course, in a positive manner. You both always do that. So at the end, that's by May 5th, then please make sure you don't have to listen to another video, but you're going to then click on the next learning unit, which is really, and it will be available to you as soon as you are looking at this. You're able to see the final course reflection, what the requirements are, and how to complete it and submit it, all by May 11th. So if you are running late or you're studying for another test or whatever it is, if you cannot complete everything here in Learning Unit number 14 by May 5th, take another day or two. But I do need to have everything done by May 11th. So you're welcome to do it early, but please make sure you have it all done by the 11th. And it really has been a privilege to have both of you in this course. I hope you found it to be a good learning experience. I know it's a 4 credit hour course. It's taken a lot of work and effort on your part. But congratulations in your involvement in nursing research, critically appraising articles, and evidence-based practice.